My name is Erin Richardson, and I'm a clinical social worker at Agor Behavioral Health. So I specialize in working with adults. However, I also specialize in working with the aging population. I'm one of only 10% of geriatric social workers in the nation. So a lot of people have a fear that's associated with working with the aging population. So I think a lot of that fear is just not being able to meet people where they're at. And I think that's one of the most important things to do in our sessions is to meet someone where they're at and to be able to become the best versions of themselves. So I think one of the most difficult parts of starting the therapeutic process is having the courage to seek the help in the first place. I think the stigma around mental health has been such a challenge to overcome in my profession, and it's important for each of my clients to understand that I can be an impartial resource and an advocate for them especially when there's an intergenerational gap. Well, I do offer the initial session just to sit down and meet with one another, just to get to know one another. I think it's important to establish a sense of rapport with each and every one of my clients. But establishing that rapport is really just being able to meet face to face and have a conversation. Especially with the aging population, I think it's important for them to understand that our sessions are confidential, and so a lot of them feel as though they can't talk to someone. Their families are just too close to the situation. So when that happens, I want them to feel like they're in an environment where they can just open up and talk about whatever is on their hearts.